Hey everyone, Jonathan Kaplan, Real Dr. Bay, plastic surgeon, San Francisco Bay Area. We are still a plastic surgery practice, but our weight management program has sort of taken off. The history behind that is that we had patients coming in about a year ago for tummy tucks and other body contouring procedures, but they really were severely overweight. They weren't good candidates for a body contouring procedure, which is what a tummy tuck is. They were more a candidate for a weight loss procedure, like medication or surgical weight loss. Anyway, so we started the weight management program to help those patients to bring down their weight, so that maybe if they decided after getting to their goal weight, if they did have excess skin, then they could go on and get a tummy tuck. But some patients just lost weight and they didn't need a tummy tuck. Their skin tightened up on their own, and that was great too. So we didn't need to actually operate them. So we were reducing the incidence of obesity in America. So that was a good day as well. Anyway, so fast forward to more recently, Ozempic and Wegovy have taken over. They've gone viral. I mean, I think our most recent TikTok post has like 2.8 million views on it, which is first time I've ever gone viral, so that was exciting. But anyway, we were talking about how whether Mindy Kaling has been taking Ozempic or Wegovy. And so I just want to give everybody some background on all this. Of course, you can ask questions. But Ozempic and a lot of other class of medications that you've heard of, like Zexenda and Mounjaro, those are all called glucagon-like peptides receptor agonists. They're these types of medications that were developed to treat type 2 diabetes. So that's the type of diabetes that's not insulin dependent. Those are the type of diabetes. Type 2 diabetes is the one that is caused by obesity. So the idea is that they started out with Ozempic, and they came out with that in 2017. It was that glucagon-like peptide receptor agonist types of medication, and they found that it did reduce A1C and sugars, but it also resulted in weight loss. So then they went ahead and got that approved as Wegovy, same active ingredient, semaglutide. They got that approved as Wegovy, and that is specifically for obesity. So when people talk about you shouldn't be taking these medications because for type 2 diabetics, well, they're actually approved for obesity now. And remember that obesity leads to type 2 diabetes. So now that those medications are in a shortage, the FDA allows a compounding pharmacy to duplicate those medications. And so that's one rule, that you can actually get the medication or create the medication at a compounding pharmacy, even if it is a commercially available drug. So we're able to get semaglutide, the active ingredient of Ozempic and Wegovy. We're able to get that from a compounding pharmacy and include that as part of our weight management program. So patients are able to sign up for our program, which is 6 months long. We help with coaching, diet, exercise, really help kind of some serious behavioral changes, and using semaglutide to help them get to their goal weight as long as they meet the criteria for obesity. And then once they get to that goal weight, then the idea is that they would stop the medication, continue full tilt at diet and exercise so they can maintain their weight. So what is obesity? Well, it's defined as a body mass index, which is when you take your weight and your height, and a body mass index. You can actually go online and just type in BMI calculator, and you can find out. They could type in what your weight and height are, and you can find out what your BMI is. But if your BMI is 27 or greater, plus some obesity-related diseases like high cholesterol, high blood pressure, diabetes, if you have those things in addition to the BMI of 27, then you're qualified for the medication. If you don't have those medications, but you have a BMI that's greater than 30, then you also qualify for the medication. So that's how we decide whether patients are candidates for semaglutide. They do our weight management program. We do an initial consultation, and then we follow them for 6 months while they're on the medication, the semaglutide, which is a once per week injection. And we follow them for those 6 months because we start at a low dose, and then we slowly increase to a maximum dose from 0.25 milligrams to 2.4 milligrams. And then that way we can determine if they're going to have any side effects and how we address those side effects. But even if they have the side effects, that as long as they feel like the benefits outweigh the risks, then it's okay to continue taking them. The medication for the program, it's $11.99 for the 6-month program. That includes a journal, a scale, Bluetooth-enabled scale so we can track your progress together, and also baseline lab work, and then the coaching and everything for 6 months. So that's $11.99. Then if you do want to use the semaglutide, if you want to do that as part of your weight management program, then the cost of the medication is $420 per month. We have that set up as a subscription. So you go to a website, we send you a link, you upload your credit card details, and then you can, every 28 days, you're automatically charged. That way we don't have to keep your credit card on file. Every 28 days, you're charged $420, and every 28 days, we send you 4 pre-filled syringes with the correct dosage based on where you are in the process of going from the lowest to the highest dosage. And you're automatically charged every 28 days. We send you the medication every 28 days. And then the first time you get the medication, you give us a call, let us know you got it, and then we can do an online injection training, because I know not everybody has done injections before. But the reason it is an injection is that seems to be more effective than another version of semaglutide you may have heard of as Rybelsus. That's the brand name. That's an oral medication, but the weight loss effect of that does not seem to be as effective as the injectables. So Ozempic, Wegovy, the semaglutide we send, it's all the same active ingredient, semaglutide, and we just show you how to do the injection. So that's the cost of the medication for those first 6 months. Now, Mounjaro is what's the next one that's coming out. If you can get that covered by insurance, great. But with Mounjaro, the benefit of that is, and also if you get it for a low price initially, then after those vouchers run out, then the price might skyrocket. So be aware of that whatever medication you're getting covered by insurance may not always be that good. There might be a much more significant copay. But Mounjaro, the reason they're thinking that might be even better is because that has the glucagon-like peptide that's the same as the semaglutide. But also in Mounjaro, they also have a GIP, which is a glucose-dependent insulinotropic polypeptide, and that also helps suppress appetite even more. So with the GLP-1 receptor agonist plus the GIP with it that's in Mounjaro, that the weight loss on that drug might be even greater. And currently Mounjaro is going through testing. So because right now it's just for type 2 diabetes, they're going through testing to get approved for obesity. So look for that on the horizon. That whereas Ozempic and Wegovy are semaglutide, Mounjaro is tirzepatide. And once that's available, and that'll probably be a shortage as well, then we'll be able to get tirzepatide from a compounding pharmacy, and people may see even greater weight loss with that. Unfortunately, we are only able to provide the medication in California. That's where my license is, so I can only provide this medication in California, which last I checked, the percentage of people that qualify as obese in California is about 11 million people. So a lot of people out here probably considering this medication. Even though you can take the medication for the rest of your life, that is not how we're prescribing. That's not our intention. Our intention is with the 6-month program with diet, exercise, training, behavioral changes, using the medication to get to your goal weight, that once you get to your goal weight, then continue full tilt with the diet and exercise and get off the medication. So that is, as far as the differences between Ozempic and Wegovy, they're exactly the same active ingredient, which is semaglutide, and then Mounjaro is a GLP-1 receptor agonist plus that GIP polypeptide that I was talking about that reduces the appetite even more. So, but they're all really within the same class of medications that were originally came about for type 2 diabetes, and now they're being approved for obesity. And people who have type 2 diabetes that are having trouble getting the medication, there are multiple options within that class of medication. This is not the same as type 1 diabetes, where those people have to have insulin or they will die. Type 2 diabetics have multiple options with these medications. And without the medications, they can also implement, they can get other medications to help address their type 2 diabetes. But with diet, exercise, fasting to reduce their the spikes in insulin, reduce their insulin insensitivity. That's another way that type 2 diabetics can treat themselves. It's not the same as type 1 diabetes, where those patients are definitely dependent on insulin, and without insulin they will die. That's not the case with type 2 diabetes. There's lots of other names of medications in this class. As I mentioned, there's Saxenda. The problem with Saxenda is that it's a GLP-1 receptor agonist. That's also an injectable, but that's a daily injection. Whereas the semaglutide that I'm talking about, the Ozempic, the Wegovy, those are weekly injections. Trulicity is in the same category as that. That's a dulaglutide is the way you say that one, or probably not well. But yeah, Trulicity is within that same category of drugs, just like Saxenda, just like Rybelsus. But Rybelsus is a oral medication. Saxenda is a daily medication. Wegovy and Ozempic are weekly medications. Mounjaro is a weekly medication. And so the injections that we send out to patients, those are also weekly injections. And we send it. I know that there are some places where they'll send you a vial, and then you have to know how much to pull up from the vial, and then do the injection. We send you a pre-filled syringe on ice, so when you get it, you put it in the refrigerator so that it stays good. And but we pull up the medication in the syringe so it's ready to go, and we do an injector training virtually or in person if you want to come in. If you're near us in San Francisco. But for anybody in California, we're able to provide this medication. We can do everything virtually, the coaching, the injection training, and then we just mail you the medication every 28 days after your subscription is updated. So we've tried to make this as seamless as possible. Again, the medication to help you get to your goal weight. We don't mean for this to be lifelong medication. And then after you lose the weight, because I'm a plastic surgeon, you may decide you still want to get surgery, or you may lose the weight, your skin tightens up. And as I said before, whether you get surgery or we just reduce the incidence of obesity in America, either way, it's a good day for us. So we're happy either way. As far as if you want to find somebody who can provide semaglutide, these medications out of state, outside of California, the best thing to do is Google doctor near me with semaglutide. That is the best way to find somebody near you that provides this medication. We just can't do it outside of California. The type 2 diabetes, the idea there is that how does that come about? Of course, type 1 diabetes, let's start with that these patients don't produce enough insulin, and so they will die without getting insulin injections. That happens because of maybe an autoimmune disease that attacks the cells in their pancreas that produce insulin. So those type 1 diabetics definitely need insulin. Type 2 diabetes is completely different and totally avoidable. Type 2 diabetes is caused by obesity. By eating too much, you bring in too much sugar, it stimulates your pancreas over and over again to produce more and more insulin. And then your end organ tissues become less responsive to insulin. So that's called insulin resistance. Your body doesn't respond to the insulin, so the sugar doesn't go into your tissues, so you don't have that energy. And then you keep eating sugars and things like that and carbohydrates. Your insulin keeps getting produced by your pancreas until it gets burned out, basically. And that's when you enter type 2 diabetes, and that's why you have to have these medications to help squeeze out a little bit more insulin. But then these medications are also beneficial in that they help you lose weight, reversing the effects of obesity. So eventually, not only are you no longer obese, but you can also get off the medication as long as you stick with diet and exercise, and you can stop being a type 2 diabetic. So type 1 diabetes, not reversible. Type 2 diabetes, absolutely. Diet, exercise, and these medications will help it make it go faster to get to your goal weight. It won't be obese. And then you can reduce your insulin resistance, so you become more insulin sensitive again, like you in your normal state. And you're also, the idea is you're trying to reset your body set weight, so that each year you notice you're getting a little heavier because your body set weight's going up and up. But if you reduce your insulin resistance, you get back to a normal homeostatic insulin sensitivity, lose weight, you can reset your body set weight. And with continuing diet and exercise, even after getting off the medication, after you get to your goal weight, you can maintain that. The problem with this is you're going to have to diet and exercise the rest of your life. And I know people think, oh, it's just easier to take the medication the rest of my life. Well, that's going to get expensive, especially if your insurance doesn't cover it. Even if you have a voucher initially to cover these medications, those vouchers won't necessarily last forever, and the medications can definitely get significantly more expensive. So the diet and exercise, really maintaining that after you get to your goal weight with these medications, is probably the least expensive way for you to stay healthy as long as you can and get your insulin resistance down, get your homeostatic insulin sensitivity back to its normal state. And that way you can keep the weight off, stay healthy, and hopefully get off the medication and save some money not having to pay for the medication every month. But as somebody asked earlier, all in, on average, the medication through our program is about $600 on average per month. That includes the $11.99 6-month weight management program. That includes shipping. That includes the coaching. That includes the medication. So on average, total all in, it's about $600. But the medication itself, when you actually go online and actually purchase the medication subscription so that you get it every month, we send it out every month or every 28 days, that's $420 per every 28 days. And the $20 is for shipping. And we can send that to everybody in California, as long as you meet the criteria of having a BMI of greater than 27, plus some comorbid conditions like diabetes or high blood pressure or high cholesterol or other obesity-related diseases, or if you don't have any of those diseases, then your BMI has to be at least 30 or greater. It's pretty wild how as far as a diet, that is something that we'll discuss during the coaching with our nurse practitioner and you during the coaching sessions. We can do any diet that you feel like you can maintain that works for you. It won't be a calorie counting diet because that's been proven over and over again. Calorie counting does not work, but it could be a keto diet that works best for you. It could be a intermittent fasting diet that works best for you. So it really is all depending on what diet works for you and that you can maintain, that you can stick with even after going off the medication. And if you don't stick full tilt with your diet and exercise that we've tried to instill with you during that 6-month weight management program, then yes, you will regain the weight if you go off the medication. But that's kind of the way Botox works. If you stop using Botox, the wrinkles will come back. So the diet is really whatever you can maintain and stick with. Somebody here just started Wegovy 2 weeks ago, so that's great to see. Hopefully you will start to see some results in the first month. That's what we're finding, is that patients are starting to lose weight in the first month, and then we increase the dosage. So basically into the 5th month, you'll get to your maximum dose, going from 0.25 milligrams to 2.4 milligrams once a week. Once you get to that maximum dose, that's when you're going to start to see where you're really losing your weight, getting to your goal weight. And of course, there are side effects. There could be bloating, burping, because there's the medication works through delayed gastric emptying. It slows food going from your stomach into your intestines, and that can result in burping or bloating, abdominal pain, nausea, vomiting. So there's every medication has its risks, but as long as you feel like the benefits outweigh the risk and you're getting a benefit from it, then that's great. We do get baseline lab work on everybody before they start the medication. We just want to see what your A1C is. And what we're finding with a lot of patients, we are talking about Mounjaro and a lot of other medications within that same class. But the thing that we're finding that's amazing is that a lot of the patients who are obese, they don't have type 2 diabetes yet. They might be pre-diabetic, but that's what's so great about this medication that's now available for obesity, is that you can keep from getting obese now, so you don't get type 2 diabetes. But the Ozempic, the Wegovy, those are the same active ingredients, semaglutide. Mounjaro is tirzepatide, a different type of active ingredient, but all the same GLP-1 receptor agonists that help lower your A1C if you do have type 2 diabetes, and it also helps you reduce your weight. The Mounjaro has an additional polypeptide or protein in it that helps reduce your appetite even more. So the results of Mounjaro are pretty amazing, how much weight loss people are getting from that. The thing is, at this point, Mounjaro is only approved for type 2 diabetes, but they are going through the studies to get a sister drug that is approved for obesity. So that's what all these medications are doing. All these companies are doing is that they come out with a one that's approved for type 2 diabetes, and they get that same active ingredient reapproved for obesity. So when you say that people are taking it for type 2 diabetes, they shouldn't be using it just for obesity, stop saying that. It's not true that these are approved for type 2 diabetes and for obesity, and it's okay for people to be taking it for obesity, because obesity is what keeps you from getting type 2 diabetes. We're not talking about type 1 diabetes, totally different thing. Those people are insulin dependent. They are not using these medications. In fact, these medications we're talking about aren't even approved for type 1 diabetics. So please keep that in mind. Don't shame people who are taking these medications for obesity, because they are approved for obesity, and obesity leads to heart disease and diabetes. And so if we can keep people from getting to that point, that's a good thing. And it's also approved for type 2 diabetes, so that we can bring them from back from the precipice and keep them from staying type 2 diabetics, help them lose weight, get rid of their obesity, and be off the medication and away from type 2 diabetes. Now, if you're talking about celebrities that don't meet the criteria for obesity, then okay, I understand that. But in this case, Mindy Kaling, who's behind me, that I know that she had been struggling with her weight for a long time. So she's not necessarily just taking it for vanity. She was definitely meeting the criteria for obesity, and now she was able to lose weight, and she looks great. And she's very happy in her skin now. Somebody was talking about that they got Ozempic with insurance and then it stopped. That's the problem. That's what I was telling somebody. People are raving about how they were able to get Mounjaro in for $25 a month. Those are with vouchers that get you hooked, and then they stop, the vouchers run out, and then you can't get the medication for that inexpensive a rate anymore. And if your insurance doesn't cover it any further, then you could be paying $1,300, $1,400 a month for these injections. And with our program, if you're in California, it's $420 a month after you join the weight management program. So all in, it ends up being an average of $600 a month. So significantly less than the name brand. And you can't even get the name brand right now. We're able to get our medications through a compounding pharmacy, which this compounding pharmacy is considered, it's got this designation of being an outsourcing facility, which may not mean anything to you, but according to the FDA, that means something, that they're supervised by the FDA. So the medication we're getting from a compounding pharmacy is the same version of active ingredient semaglutide that's found in Ozempic and Wegovy. It's just a non-name brand generic version. It's not necessarily generic in the sense that it's being produced by another pharmaceutical company because the patent's run out, but because the patent hasn't run out. But the compounding pharma is able to make these semaglutide duplicate medications because there is an FDA shortage list, and because Wegovy, Ozempic, and tirzepatide, which Mounjaro is on the shortage list, these compounding pharmacies are allowed to make a duplicate of these medications. Now, they may not always be on the shortage list, and then at that point, if those drugs are taken off the FDA shortage list, then the compounding pharmacies won't be able to make duplicates of them anymore, which is why people who are entering our program, as long as you're in California, if you're entering our program, we are stockpiling the medication to make sure that we can at least guarantee you a 6-month supply of these semaglutide injections. That way, during the 6-month program, you don't run out of it. And after the 6 months, if there's still a shortage and we can still get it, then you can continue on. But we just want to make sure that we at least have the medication for the 6 months so you can complete the program. You won't necessarily reach your goal weight during that 6-month program, but you'll certainly be on your way with diet, exercise, and the medication. And hopefully we'll still be able to get the medication from the compounding pharmacy so that you'll still be able to continue with the medication until you get to your goal weight. Now, I'm not saying that you have to take these medications for the rest of your life. You can. That's different than phentermine and fen-phen. If you remember, fenfluramine and phentermine were big back in the 90s. Those were appetite suppressants. You could only use those for 90 days. Plus, fen-phen was causing heart valve problems, so they stopped providing the fenfluramine. You can still take the phentermine, even still today. You still have to get baseline EKG, but you still can only take those for 90 days. So that's, the FDA hasn't approved those for longer than 90 days, specifically phentermine. But people are asking why the Wegovy works, but the Mounjaro doesn't. I don't exactly know why they don't work because they're both really in the same class. Plus, Mounjaro has an additional protein in it that helps suppress appetite also. It may also be, depending on how long you've been taking it. Maybe you took the Wegovy for 6 months and you saw an effect. Maybe you're only taking the Mounjaro for 2 months, and so you haven't really gotten to the maximum effect yet. That might have something to do with it, but only having this question in front of me, it's not enough. My doctor won't prescribe the medication because I'm state I don't qualify for discounts when out of pocket. So their doctors may not be prescribing Ozempic and Wegovy because if you don't have type 2 diabetes, they may still be under the impression that you are not allowed to get Wegovy because you're not a type 2 diabetic. But that's the thing, is Wegovy is approved for obesity, so you may have a chance of getting it covered by insurance, especially if you're a type 2 diabetic. If you're taking the Wegovy for obesity, you may not have as much luck getting insurance to cover it at this point. Things may change. But yeah, people with PCOS, we're definitely seeing patients who are obese, have a BMI of greater than 30 with PCOS, and we're definitely able to prescribe them the semaglutide, the active ingredient that's in Ozempic and Wegovy. This person took tirzepatide for 5 weeks and barely lost 4 pounds. I would argue that 5 weeks is not enough. You definitely need to be taking that for longer before you pass judgment for Mounjaro, in case anybody missed that when I discussed it earlier. But Mounjaro, between the glucagon-like peptide receptor agonist part of it, which is like all these medications like Ozempic and Wegovy, Mounjaro also has a glucose-dependent insulinotropic polypeptide that helps reduce the appetite even more. So Mounjaro, big exciting things are being seen by Mounjaro. They're getting it reapproved for obesity. Right now it's just approved for type 2 diabetes. So they are working on getting it approved for obesity and Mounjaro on the market. So it's already on the FDA shortage list, which means that compounding pharmacies are able to duplicate that drug right now. We're the compounding pharmacy we work with, we're waiting for them to come out with the tirzepatide version, sort of like how they already came out with the semaglutide version. And once they do, we'll hopefully be able to get that for our patients. But as far as diet and exercise, we just really want you to be on a diet and exercise that you can maintain even after the 6-month program, after we try to instill those behavioral changes with you. But you just really have to find a diet that works for you, whether it's keto diet or intermittent fasting. I personally do intermittent fasting. I'll have maybe coffee during the day, but no milk in it, and you can't put Splenda in it, even though that doesn't have calories. That can still cause an insulin spike. So I do the intermittent fasting all day, and then I'll eat at night. And then on the weekends, it's a little tougher because my wife wants to go out to breakfast, and she won't put up with with me not eating on the weekends, so I can't do that. Anyway, so let's see. Lots of good questions. So yeah, if you are not in the California, I can't get the medication for you, but I would just recommend Googling doctor near me with semaglutide, and you'll probably find somebody. I can't speak to what the other programs are like out there. I can't speak to the medication they're getting. I do know that we've had this relationship with this compounding pharmacy for over a year, so I feel very comfortable getting the medication from them. They're legit, and it is the active ingredient, the semaglutide. But as far as getting insurance to cover these things, we're not dealing with insurance. It's just too complicated. But somebody was asking, does the medication help with insulin resistance? That's absolutely how it helps. By reducing your appetite, you eat less, you have less intake of carbohydrates and sugars, you have fewer insulin spikes, and that helps reduce your insulin insensitivity back to becoming more insulin sensitive, getting you back to a more homeostatic normal insulin sensitivity. So these medications definitely help with that. Let's see, can you prescription compound semaglutide in California? We are not getting this semaglutide from a compounding pharmacy in California. As far as we know, there's not a compounding pharmacy in California that offers it. We're getting our semaglutide from a different compounding pharmacy outside of California that is allowed to sell it to us in California. Somebody was talking about nausea and vomiting after these medications. That's absolutely possible. I talked to a patient today, not from us, but I talked to a patient today who accidentally got the highest dose of semaglutide, the highest dose of Ozempic or Wegovy from the pharmacy, and she took it and she started having terrible nausea and vomiting. That's why we started a low dose on purpose, 0.25 milligrams, and we increased the dosage over the first 5 months or so. We get to the maximum dose into the 17th week. So we monitor you during the 6-month program. We slowly get back, go up to the maximum dose so that you hopefully minimize and avoid all of those severe side effects of the nausea and vomiting. Can't guarantee you won't have them, but again, if your benefits outweigh the risks, you can continue the medication. The BMI that you have to have for this is you can have a BMI of 27. By the way, if anybody doesn't know what body mass index is or what yours is, semaglutide and these other medications that we're talking about, or if you don't have any of those diseases but your BMI is greater than 30, you're also a candidate. So that's what. Are we able to get the compounded tirzepatide? Not yet, but we know the compounding pharmacy that we work with that is duplicating the semaglutide, because semaglutide is on an FDA shortage list. They are actively working on a tirzepatide duplicate. So once we have access to that, we will definitely be getting it. As far as somebody was talking about Kaiser prescribing it, but you can't get it. So unfortunately, even though you obviously would like your insurance to cover it, if you really want this medication and you are in California, you are able to pay out of pocket for it substantially less than what the name brand would be, and you'd be able to get it because we have a really robust supply, and we're making sure that somebody's asking if semaglutide causes hair loss. I've had other patients ask me that. We have not seen that in our patients. Anyway, so the medication, we're trying to make sure that we get at least a 6-month supply for everybody in our weight management program, so that at least during the 6 months, they definitely have a supply of the medication going all the way from the 0.25 milligram low dose to the 2.4 milligram. If you want to know how to get into our program or learn more about it, just go to our link in bio. You can actually, there's a Q&A. You can actually purchase a consultation online. It's a $100 consultation fee, but that goes towards your weight management program, which is $11.99. So that would bring it down to $10.99. But because we have a lot of people reaching out for consults, the best way to do it is pay for the consult online at the link in bio, and then we'll get you in as soon as possible for a virtual consult. Somebody's asking if they can stay at the 0.25 milligrams long term. Well, if you can, but you may not be getting the maximum effect from it. You may not get the maximum weight loss, but you'll decide there. If you're getting good weight loss with the 0.25 milligrams, you may be able to stay there. There are definitely instances where we don't have to go to the maximum dose of the 2.4 milligrams, that we're seeing weight loss at lower doses, but I don't know if we can do that if we're going to get the maximum weight loss at the lowest dose. So it may not require the highest dose, but I don't think it's going to be possible at the lowest dose. And these are not a stimulant. That's what's so nice about these. It's like the first time. I mean, we don't really mean to be in the weight management business, but because I'm a plastic surgeon, we were having a lot of patients coming in about a year ago with a higher weight that they weren't really a body contouring candidate, because that's the thing, is they think maybe sometimes patients think a tummy tuck is good for weight loss. It's not a weight loss operation, it's a body contouring procedure. So if you really are severely overweight, you're really not and you have a really high BMI, you're not a good candidate for surgery. The results may not be as great if you're not at a lower weight. So that's why we started the weight management program. But that's why that's why we're offering that to people, so that they can lose weight, and maybe they'll still decide that they have loose skin and they want to get a tummy tuck, or they'll decide that they've lost the weight, the skin is tightened up, and they're good to go. So that's kind of how we are addressing this weight management program. But if you are interested, you can reach out, go to the link in bio, and you can pay for the consult. You'll get in quickly, and then we can assess whether you do have a BMI that's high enough, whether it's 27 plus some other diseases, or above 30, and then you would be a candidate for it. But as far as the long-term side effects, I've already talked about burping, abdominal pain. There's a risk of pancreatitis, which is inflammation of the pancreas. If you have a history of kidney problems, then the medication can make you dehydrated. So obviously you want to hydrate. That could cause problems with the kidney. But the biggest concern a lot of people have is thyroid cancer. So they were able to see that in lab rats that were tested with these medications, that the longer the lab rats were on the medication, that some of them did develop thyroid cancer. They didn't all develop thyroid cancer, but it is possible that some of them did. Now, that means it's possible that humans could get thyroid cancer, but this drug's been out since 2017, the Ozempic version, and I have not heard of a lot of any patients really actually getting thyroid cancer. Now, if you have a history of thyroid cancer, then you're not allowed to take the medication. They rule you out from the get-go. So if you have a history of thyroid cancer, you're not going to be able to take these medications. But I have not seen any reports of somebody without a history of thyroid cancer getting thyroid cancer from these medications, but it is something we're worried about. I would argue, though, that if you are trying to decide whether to take the medication or not because you're worried about thyroid cancer, I would say that your risk of becoming more overweight and getting heart disease and diabetes and dying from heart disease or diabetes, that risk is greater if you don't take the medication and continue to stay obese or get more obese. That risk is greater than your risk of getting thyroid cancer if you go on the medication. That would be the way I would assess your risk of getting heart disease and diabetes from staying obese or getting more obese by not being on the medication. That's going to have a greater incidence or risk of you dying from those diseases than you getting on the medication and your risk of getting thyroid cancer. I don't think it's going to be that common. I'm not saying nobody's going to get thyroid cancer for this, but I have not seen anything about it. What we do is tell patients, if you don't have a history of thyroid cancer and you do go on the medication, then we do want you to check your neck once a month. You don't necessarily know where your thyroid is, but check the whole midline of your neck and feel any lumps or bumps that may or may not have been there the month before. Check it once a month. And if you're feeling some new lumps or bumps or have some new onset hoarseness, those are things you need to start thinking about whether you have an issue with your thyroid, and you go in and you get that assessed. The main thyroid cancer that they're worried about, that they don't want people to take the medication, is if you have a history of medullary thyroid cancer or you have a history of MEN type. What that is, you probably don't have it in your family. If you do know what it is, then you probably do. But other more common risks: vomiting, feeling bloated, burping. Those are kinds of things that can happen with these medications, because that's partially how they work, is through delayed gastric emptying. So food goes from the stomach to the intestine slower, so you feel more full, so you eat less. The other way it works is it suppresses your appetite in the level of the brain, in the unconscious. And so that can do it. As far as if you have thyroid nodules, then you absolutely need to get that worked up before you go on these medications. And then you need to have a doctor that's not on TikTok seeing you and assessing you and making that decision. But you definitely need to get assessed first before going on these medications if you have a thyroid nodule. And now, of course, the question everybody always asks is if you regain the weight after stopping the medication. It's like anything that if you stop doing it, you're going to have potential for that not working out anymore for you. So, for example, if you stop Botox or anybody's program where you really instill some behavioral changes like diet, exercise, to that, and then you use this medication as a temporizing measure to help you get to your goal weight. Then once you get to your goal weight, however long that takes, it might probably take more than 6 months, but once you get to your goal weight, then you stop the medication. As long as you keep the pedal to the metal, you keep full tilt with diet and exercise, then yes, you can maintain your weight. But if you stop exercising, then yes, you'll definitely gain the weight back. Maybe the weight loss medications you might have been hearing a lot about. They're all part of a class of drugs called glucagon-like peptide receptor agonists, GLP-1 receptor agonists. They help you lose weight in addition to helping you with type 2 diabetes. They originally came out in 2017 under the name Ozempic that helped with specific with type 2 diabetes, but once they found it helped people lose weight, then they got it reapproved and remarketed as Wegovy in 2021. They're the exact same active ingredient, which is semaglutide, which is the medication that we're able to get from a compounding pharmacy because there is such a shortage of these medications. Whether it's a shortage because of type 2 diabetics taking it, people taking it for obesity, please don't be judgmental and say, oh, this is just for type 2 diabetics. No, it is also for obesity. It's okay to take it for obesity. It doesn't make you vain to take it for obesity. Obesity leads to heart disease and diabetes, and that's something people die from. So if you can take these medications for obesity and avoid getting type 2 diabetes, that's a good thing. But as far as long-term side effects, we talked about in rats that they found that they did lead to thyroid cancer in some rats. With long-term use, they haven't really seen that in humans yet, but if you have a history of thyroid cancer, then you're not going to be able to take it. And even if you don't have a history of thyroid cancer, then we cancer. Let's see. But it is a very specific type of thyroid cancer called medullary thyroid cancer, or one that's associated with MEN type 2. So I know people are worried about anything that has the word cancer in it, but there's just not evidence that this is a major problem. Keep in mind that this medication has been on the market since 2017. I think if everybody was walking around with thyroid cancer for these medications, we would all know about it. Again, and I can't state this enough, I think your risk of dying from heart disease and diabetes by staying obese and not taking this medication, the risk of that is higher than you getting thyroid cancer by going on the medication. So enough with that. So yeah, the same active ingredient, semaglutide, that's found in Wegovy and Ozempic, that's what we're getting from the compounding pharmacy. And what we do is we send it to patients on ice, and then they put it in the fridge. They reach out to us, let us know when they get their first shipment. We do an online injection training so they know how to do it. But again, this is only for residents of California. We can't prescribe this outside of California. What we do require is that you have a consult. We make sure that your BMI is appropriately high enough to be considered obese, or obese enough, and have some comorbid conditions like obesity-related diseases like high blood pressure and diabetes. And then we after we assess that, and you decide to enter our program, which is $11.99. The $100 consult fee goes towards the $11.99. So the 6-month weight management program that includes coaching is then reduced to $10.99. And then that includes coaching for diet and exercise so that we can help instill some behavioral changes so that when you eventually go off the medication, you will hopefully stay at your goal weight. And then we get some baseline labs. We send you a Bluetooth-enabled scale, a journal, and then once we get your labs back, if everything looks okay, then we will have you go online and go to a secure website where you'll purchase a medication subscription. of semaglutide, and so that every 28 days you'll be charged $420. The $20 is for shipping. $420 every 28 days. We send you the 4 pre-filled syringes every 28 days, so that way you stay on track with your medication. You don't get off schedule, and then there's only 7 days between each dose, from the last dose of 1 month to the first dose of the next month, and we do increase the dosage each month, where every 4 weeks we go up on the dosage. So we start at 0.25 milligrams, and then we'll eventually get up to a maximum of 2.4 milligrams over that's usually into the 5th month that we get to the maximum dose that we give that medication to that max dose. And you will start to see weight loss in the first month from what we've heard from patients, and you'll start to really approach your goal weight into that 5th month. You won't necessarily reach your goal weight by the end of the 6-month program, but you'll certainly be going in the right direction. And then after the 6-month program, you can continue the medication, but we don't make you re-up for the whole weight management program. You go from but it does go from $420 to $520 per month. That additional $100 is a concierge fee, where you can still reach out to us. We still will be involved in coaching, monitoring any side effects, adjusting the dosage if you're having some issues with some of the side effects. But basically, as long as you are seeing the benefit of the medication, you're losing weight, then that's okay for you to continue the medication as long as the benefits outweigh the risks. So those are all good things to connected there for a second. Anyway, the idea though is that the medications do work. Ghost killers, that's a funny recommendation for the price. But yeah, the $20 of that $420 does go towards shipping. Anyway, so you can continue the medication as long as you're seeing the benefit, and we will and if we do get to the point where we have access to tirzepatide, which is the Mounjaro version of all of these medications we're talking about. Mounjaro sounds like that it has an even greater appetite suppression mechanism to it, and if we're able to get the tirzepatide from the compounding pharmacy, we will start offering that. We don't know the pricing of that yet, but stay tuned. Continue to follow us on TikTok and Instagram at Real Dr. Bae, RealDrBae. If you're interested in the program and you want to learn more, then you can go to the link in bio. We have a lot of blog posts written about this, where you can continue to learn more. This is even approved for children. It's crazy what the FDA has just approved this for children 12 to 17 years old. Obesity is a real thing in kids, and it leads to obese adults. So it is a thing that is approved. So please stop being judgmental, pointing fingers at people who are taking this for obesity. It is approved for obesity. If you're taking this and you're not really obese, then I guess I would suggest to everybody, you do you. Don't point fingers. Everybody's in a different situation. We do have medications other than semaglutide for patients that have a BMI of less than 27. We do have other medications like Bella and things like that. So you do have to meet the criteria that the FDA has laid out for people to be candidates for this medication. So just wanted you to be aware of that. But if you are interested in learning more, go to the link in bio. We have multiple blog posts about this. And if you want a consult and you're a California resident, then you can actually purchase a consult online, and that'll be the way for you to get in the quickest for the consultation, because we're getting sort of inundated and overwhelmed with consultation requests. And so then if you just call and ask for a consult, then we have to play phone tag to try and get in touch with you. Whereas if you pay for the consult online, then we're going to get you in as soon as possible because we know you paid for it. And if you don't hear from us, you're going to get nervous that you went to some sketchy website, and that's obviously not what we want you to think. So if you do pay for it online, and again, that link is in the bio, then we can get you hooked up. As far as other risks, there is a risk of pancreatitis. That's just inflammation of the pancreas, and that's something that we would be watching for, and something we look for in baseline lab results before we get started with the medication to make sure your pancreas is in good shape. Or just be the beautiful person that you are. That is true. Yes, this is only for California residents. We're not allowed to send medications outside of the state. But that's how it works. I have to go now, but I appreciate everybody tuning in. There's a great crowd, a lot of great questions. Again, if you want to reach out and learn more, then go to the link in bio. We appreciate everybody's time. If you do message us, please message us on Instagram at Real Dr. Bae, RealDrBae. can message us on Instagram. It'll be easier for us to get back if all of the questions are coming funneled through one place on Instagram. But if you do message us on TikTok, we'll be sure to check those messages as well. And if you have questions about plastic surgery, which is what we normally do, also feel free to ask questions about that. We have our own in-office operating room here in San Francisco. So thank y'all so much. Appreciate y'all watching. Take care.